I would like to welcome everybody here on behalf of the Osher Center faculty and staff. We have two wonderful speakers for tonight, Dr. Baechler and Dr. Wong. They're both out of town, so they made the effort to come here and do these presentations for us, so we are very, very excited. Before I get to the get to the introduction of the speakers, very briefly about the Osher Center, who we are and what we do. That's of course me, I was younger back then. So the Osher Center, there are 10 Osher Centers across the country, and there's one in Sweden. And the Osher Centers came to existence through endowments by Mr. Bernard Osher Foundation. The foundation is sunsetting, so there are no more Osher Centers happening across the country. We bring integrative medicine into conventional systems, and all the 10 centers in the US, they are in academia. That was one of the requirements. So the goal is to bring anything that is called non-conventional into conventional and make it accessible to the patients. Our approach is individual-centric. Each individual will be receiving a holistic approach to health, and we will review what services we have. We have integrative medicine consult, integrative medicine in primary care that Dr. Bell is doing. We have acupuncture, we have massage therapy, and we have nutrition consults and to some degree lifestyle modifications that we have under the umbrella of integrative medicine. These are the 10 centers that we have across the country, actually 11, because it includes Karolinska here. We do have a body, an administrative body that's called Osher Collaborative, and the Osher Collaborative is in UCSF, San Francisco. They are the administrative part of the Osher Centers collectively, and they help us organize our activities. Each Osher Center is unique. There is no prescription for all, that we all have to follow this path. Each center, based on the requirements, needs of that area, they have different characters and approaches to health, but we do collaborate with each other, and the collaboration comes through the Osher Collaborative. Now, Cha Ching-ming Endowed Fund. We are very grateful for the Cha Ching-ming family. We are very honored to have Dr. Emily Wong here, who is the granddaughter, correct, of Mr. Cha Ching-ming. These funds were given to the University of Washington with the intention of bringing non-conventional, specifically East-West medicine, and translate it in a more scientific way and incorporate it into academia. These services that we provide, such as this lecture series that we have, they're all being supported through this fund. So the Osher Center, we provide the faculty with the workforce, but the funding for these activities is coming from the Cha Ching-ming funds. So Mr. Cha Ching-ming was the industrialist and philanthropist from Hong Kong who was deeply invested in integration of traditional Chinese medicine in Western and biomedical science. And to honor his legacy and his wishes, we are committed to continue this lecture series that they have two arms. One arm is for public, that each year we have a series for public-facing virtual, and the other arm is this one, which is more for professionals and friends of Osher, that we come together and we discuss some topics together. For some of you who may not be familiar, this year the theme of the Cha Ching-ming series were Women's Health Series. And the first one was May 9th, Thriving Through Perimenopause and Menopause. The second one was September 19th, A Holistic Look to Breast Cancer and Survivorship. And they're both being recorded, so you can scan the QR code and watch the recording. The third one will be December 5th. So please mark your calendars or virtual, and everybody is welcome to join and participate in these activities. After the talks tonight, we will have a survey. We would really love for you guys to fill the survey and give us feedback, because based on the feedback that we get from you guys, we kind of plan our next series and how we want to run the show, so to speak. So with that, I kept it very brief because we are all excited to get to the speakers. I am going to invite my dear colleague, Dr. Deborah Bell, to come here and introduce Dr. Baechler.
Hello, everyone. I am just so excited to have Dr. Courtney Jordan Baechler here with us to speak. I'm going to read you her official bio, which you also see, and then I want to just say a few words about her as well. So she's a cardiologist specializing in prevention at Park Nicollet Heart and Vascular Clinic, part of Health Partners. She has a master's in epidemiology and public health and is passionate about a healthy state of well-being, body, mind, and spirit for patients, families, and communities. Previous roles include medical director for health equity and health promotion at the Minneapolis Heart Institute Foundation, assistant commissioner for the Minnesota Department of Health, and vice president for the Penny George Institute for Health and Healing. She is a national leader in holistic medicine, health disparities, and prevention. Leadership roles include co-chair for the 2035 Minnesota Heart Disease Prevention and Stroke Committee, serving on the YMCA of the North General Board and the CVS Health National Health Equity Board. And Courtney and I worked together for many years at the Penny George Institute. She was instrumental in introducing me to the area and coming there. She is an amazing, amazing, wise, compassionate healer and person. Yesterday, she gave the Department of Family Medicine Grand Rounds this amazing speech about health disparities and heart disease and the research that she's done in Minnesota and Minneapolis. And it's just wonderful to have you here, and it's just such a treat. I can't wait to hear your talk. And with that, please welcome Dr. Courtney Jordan Baechler. Thank you. Well, thanks for having me, you guys. I'm delighted to be here from Minneapolis, and I love this area, so it's really fun. We're going to dive in because I know hopefully we'll have questions and time for that, but there's lots to talk about. So just to level set, we're going to talk a little bit high level, just so we all know where we are in terms of the disparities we see around women. So we know in general, women are less likely to get preventative strategies overall discussed by their physician. When women are known to have heart disease, they're less likely to be on lipid-lowering agents than men. Black and Hispanic women have the highest rates of obesity in our country compared to any other race, ethnicity, and compared to our male counterparts. Black and Hispanic women also have the highest rates of diabetes and high blood pressure. Women who smoke or have diabetes have worse outcomes than men with the same risk factors. Women who are hospitalized are less likely to receive evidence-based medicine. We're 25% more likely to receive less suboptimal care overall. And finally, as it relates to presenting with chest pain in the emergency room, women and people of color are less likely than our male counterparts to get an angiogram. So let's talk about this. This is a poll to make sure you're awake and not asleep after eating. What percentage on average do women represent of clinical trials? Anybody know? A? Close. Yes, sorry, I thought we had 25% as an option. 30% it has gotten just a little bit better. So yes, you are absolutely right. What is the leading cause of death in women? The heart disease is right. Yep, I probably wouldn't be here if that wasn't the case. How about this one? Which of the following statements is false? Women are more likely than men to develop heart failure after a heart attack. Women are less likely than men to be prescribed a beta blocker, which is standard of care for heart failure. Non-Hispanic Black women have the highest mortality rates of death among women with heart failure, and women represent less than 25% of all major heart failure trials. So which one is false? Good job, whoever said that. It was a trick question. Yes, yes. See, there you go, because these are all true. How about this one? Which of these is not a risk factor for developing heart disease later in life? High blood pressure in pregnancy, preeclampsia, gestational diabetes, or iron deficiency anemia in pregnancy? Anybody? Are you the, what'd you say? Yeah. No pressure, huh? And do you know, Deb? Yeah. D is the only one that is not actually a risk factor because that's correctable. So that's going to kind of launch us into one of the 3 Ps that we're talking about, which again is really pregnancy is really our first one of many probably, but stress tests for your heart. And this is one of the times where we see some of the divergence in who does well ultimately and who doesn't do great from a heart perspective. If we could only fix one thing in this country, as it relates to heart disease, I should say, it would be high blood pressure. And so you can see here, chronic high blood pressure accounts for about 1/2 to 2/3 of the overall excess cardiovascular risk that we see in women with prior what we call hypertension disorder pregnancy. So it really is a huge risk factor and something that we need to mitigate long term. It ultimately can be seen during pregnancy, sometimes goes away after the woman delivers, but not always, and then again goes on to really increase your risk of a variety of things. So right here you can see afterwards only about 33% of women who actually have high blood pressure are on medications to treat that. And this I know is small, but these are all of the various areas that are at an increased risk of developing with high blood pressure. Regurgitation or backward flow of your mitral valve, narrowing of your aortic valve or aortic stenosis, heart failure, and then bread and butter coronary artery disease. So it's a complicated process in terms of what ultimately leads to hypertrophy or thickness of the heart muscle. We see decreased arterial compliance. So there's a lot of testing going on to look to be able to test arterial compliance, which we don't routinely do, but that is part of what happens when the vessels get stiff. Endothelial dysfunction, I think for the physicians in the room, that's a really hot topic. That is in fact, we see microvascular disease that way. We see small heart attacks and big heart attacks happen from that. And then ultimately this leads to premature, both ischemic heart disease, calcification, and then stroke. And you can see here that it's all of these risk factors. So, again, ischemia with the placenta, maternal inflammation, genetic risk, pre-existing cardiovascular risk factors, vascular dysfunction, and then this chronic cardiac changes that we see to adverse pregnancy outcomes that really make such a big difference. So I like this slide because I think many of us know about some of these risk factors that are more traditional. So in menopause, for instance, our cholesterol changes. That's very hot conversation with HRT replacement being more common, but our triglycerides go up, our LDL or bad cholesterol goes up, our HDL goes down. And this, again, is one of these areas where our risk of developing heart disease starts to change. Again, blood pressure control is a huge piece of things, diabetes, smoking, obesity, inactivity, family history. Here are the things that we're finally starting to talk more about. Depression, which we're going to talk more about. Turns out that mental health is 30% of your risk of developing heart disease. So again, I'm going to expand on that later, but that's as much as tobacco use, but we certainly don't talk about it the same way. Menopause and early menopause is a huge issue. And then pregnancy and how you do, as we're talking about in pregnancy, as well as basically anything inflammatory. So what, everybody has kind of always looked for what is the one thing that drives heart disease? Is it high blood pressure? Is it cholesterol? Is it your lipoprotein A? Is it your family history? It's ultimately, if you could only say it's one thing, it's inflammation. And anything that produces inflammation, whether that's ulcerative colitis, rheumatoid arthritis, or anything that is causing our body to be inflamed, increases our risk of heart disease. And these are things that, at least in my fellowship, we really didn't talk about a lot. We certainly did not talk about the risk that develops in pregnancy at all in my fellowship. And then you can see here, again, some of these that are specific to women, early menarche, early menopause, history of amenorrhea, so not getting periods, premature delivery, low birth weight, high birth weight fetuses, as well as gestational diabetes, and then hypertensive disorders of pregnancy. So we see, interestingly, that there is a little bit more predominance of women having some of these inflammatory conditions, such as lupus, rheumatoid, depression, which again we're going to talk about, as well as having more psychological stress with our role in society. So you can see how we start to get to these disparities, which again don't have so much to do with our chromosome status, but much more to do with our role in society. And then these traditional risk factors that, as I talked about, unfortunately, we have a much higher prevalence rates, and then some of these that are more equal. So ultimately, these adverse pregnancy outcomes, or APOs, really increase our risk of developing cardiovascular disease later on. You can look at the studies, but it's anywhere from 4 to 6-fold that your risk is increased if you have any of these: preeclampsia, gestational diabetes, hypertension, preterm birth, and small for gestational age. Those are going to increase all those risk factors for ultimately developing heart disease, blood pressure, cardiovascular disease, ischemic heart disease, stroke, heart failure, and then diabetes. And here is for the biochemists in the room and folks who want to get a little bit back into the physiologic side of things, kind of what's happening from a pre-pregnancy perspective, what we're seeing here with, again, that endothelial dysfunction, placental dysfunction, inflammation, our inability to adapt the way we want from a hemodynamic perspective, what happens during pregnancy, and then what happens post-pregnancy. And ultimately, as these things become less able to adapt, they get stiff, and that's ultimately where we see heart disease happen. So there's lots and lots being published about this, and you can see here that really established cardiovascular risk factors that arise after pregnancy explained about 84% of the increased risk of cardiovascular disease conferred by gestational high blood pressure, 57% of the risk. And then again, we see these other areas also being very necessary for us to do better. And there's a really big gap, which I'm going to show you here. This was an article that just talked about, again, what do we actually see? Are we seeing that folks are getting screened? Are they getting secondary screening after these things have been identified? And you can see here we have a lot of work to do. So less than 10% of internists, 38% of OBs actually provided counsel around these adverse pregnancy outcomes. I will just emphasize, I finished my fellowship in 2011. We didn't talk about this at all in my fellowship. I would say about 10 years went by where I wasn't seeing any patients for this. And now, since somewhere in the 2020 span, we're finally getting referrals from OBs and primary care about these increased risk. I would argue for other things, it's basically no different than when someone has diabetes, is at a high risk for various things like metabolic syndrome, and they get sent for a prevention consult. Folks that have been identified for this should be, and at least should really understand that their risk is increased. Because I would just also emphasize with all of this, it's not always the person you expect it to be. So there are a lot of women who exercise, are at goal weight, and have developed these issues during their pregnancy. So yes, I think our goal around prevention and what lifestyle can do is super important, but sometimes that alone isn't enough. So this is a study that we published. This was at the Allina Health System, large multidiscipline center, but we wanted to look at our own data and see how were we doing in terms of identifying these folks that had had an adverse outcome in their pregnancy, and were they getting their risk reduced, whether that was seeing a nutritionist, seeing a primary care doc, seeing a cardiologist, seeing an OB, whatever the case was. We were doing horrible. And again, this is in 2021, and interestingly, there was a disparity in who was getting that information, and it was mostly white women that were getting it. And for Black and brown patients, your risk, which is higher, was less of getting identified and ultimately referred to a resource. So again, as we're looking at ways that we can be a part of the solution, this was definitely one. So one of the things that we did is we put this together just as a way to help people understand a little bit more than just kind of the traditional things that we hear about. And because education, which is part of why we're here, is such a big piece of that puzzle for folks to understand. Almost everybody has something on the slide that we could do differently or perhaps slightly more optimal than what we're doing. And smoking e-cigarettes, smoking with birth control pills, pregnancy weight not being lost. It's a huge, especially with multiple births, challenge of folks not getting back to that pre-pregnancy weight and then having a second or third and adding on high LDL, autoimmune disorders, menopause. Again, lots of information about that. Less than 45 is where the risk starts, and before 40, even earlier, or at higher risk. Like we talked about, pregnancy conditions, birth weight of the baby, depression, cancer treatment, type 2 diabetes, and high blood pressure. So here's just a little look at some screening for, again, the docs in the room. This is what's really recommended in terms of how frequently folks should be screened, what those numbers should be, when we should start looking at cholesterol levels again, blood sugar, and then again, obesity, tobacco use, and nutrition. I'm going to get into this a little bit further. So I just want to point out this because I think this is super important. The bottom line is what our blood pressure should be is 120/80. We really do nothing for the diastolic or bottom number, so I don't think you have to worry so much about that. But everybody should know if you are under 70, your blood pressure should be 120 on top or less, or we should be doing something to treat it. So I think one of the cardiologists that I see on social media just posted that Omrons are on sale on Amazon. He's not trying to promote anybody, but I do love Omrons are great. I think they're $40 now, but people should, with what we talked about, how much we could change was just people having their blood pressure under control. I think this is a huge thing for you to actually know what your blood pressure is. There is white coat hypertension. So yes, a lot of people's higher in the office. You should be sitting legs uncrossed for 5 minutes, ideally with your bladder empty. All these things that are usually not done in the office. I rarely start medications in the office for that reason. But then that relies on you knowing what your blood pressure actually is. And I think it's probably the easiest thing for us to treat and change things. There's all sorts of ways to combat blood pressure, which we're going to talk about some of those later. Lots of integrative approaches, lots of lifestyle approaches. And then sometimes, like one of my dear friends from medical school, smallest of all of us, does yoga every day, doing everything right. She's been on blood pressure meds since she was 35. So sometimes you need to think of a harm reduction strategy to avoid what could ultimately happen later. We really don't worry so much about the stages anymore. It just matters whether or not you actually know what is considered. And when you look at the studies, it actually starts to go up at about 115 millimeters of mercury. So 120, if you're 70 or under, is too high. And so again, here's just some of the basics that, we've talked a lot about. So sex-specific risk factors here. You also have PCOS, which we haven't mentioned, but that is certainly a piece of things. Otherwise, we've talked about all of these things. And then really getting into some of these more traditional American Heart Association things like the Simple 7, you've probably all heard of, but we're going to talk more about. And then having somebody calculate your 10-year risk, I think is important too, because it really starts to change things as to figure out whether or not medications might be appropriate for you that way. So here's just one more emphasis because you know how much I love blood pressure. And I just think it's really important to see how much of a difference we could lower these conditions if people's blood pressure was treated in whatever way works best for them, but that it was ultimately treated.
So let's talk about some of the other stuff as it relates to prevention and ways that we can do that. So I think this is a big piece that everybody should walk away with. These are things that we could all do differently tomorrow, at least some of them, thinking about our weight. And I think there's all sorts of categories around that. Is BMI the best test? Is waist circumference? But I think we get to a certain state and we know when we don't feel comfortable, we're not at our ideal weight, whatever that is for us individually, but it's a problem for our society with 70% of us being overweight or obese. Obstructive sleep apnea, I think, is a really important thing that we don't talk a lot about. A lot of people have it that aren't overweight, and it happens to just be an anatomy thing for folks. So some people, their jaw, their septum, huge risk factor for high blood pressure, fatigue, weight gain, inflammation, heart rhythm, problems like atrial fibrillations, and heart failure. So I am probably the number one referral for sleep apnea studies at our place, because if I see somebody that we cannot get their blood pressure under control, they're exhausted all the time, that's the number one thing I'm thinking of. And it really, people's hearts get quite large that have had untreated sleep apnea for a long time. The systems have gotten way better than they used to be. I don't think the CPAP today is not your grandpa CPAP of yesterday. So diet, movement, stress, and then, referral when needs to be appropriate. So again, I think these you guys have heard lots about, but I'll just point out some that we haven't talked as much about. Alcohol is definitely a risk factor. It has a J-shaped curve, so some is okay, though even that is getting to be more and more controversial. But as it relates to the heart, a little bit is fine. Too much produces high blood pressure and heart failure. For most people, for women, that's no more than 1 to 1.5 a day, 2.5 for men. Like I talked about, these ones we're going to all jump into a little bit more. This is one of my favorite quotes because it's so old. I'm sure a lot of the integrative folks know this, but this was from Hippocrates himself. You ought not to attempt to cure the body without the soul. The cure of many diseases is unknown to physicians because they disregard the whole. For me, part of what led me into integrative medicine was when I first graduated and was practicing for the first time. I had a ton of patients who would come in with heart palpitations, various things, and I'd put a monitor on them, get an echocardiogram. I'd say, great, it's not your heart, you're fine. Go back and see your primary care, which is, I know, everybody's favorite thing for cardiologists to do. And these women kept coming back. They were, a lot of them that I was seeing as a female cardiologist were women, and they kept coming back and coming back and coming back. And I realized that the toolbox that I had was pretty small, because they didn't want to be on beta blockers, they didn't want to be on calcium channel blockers. And then I had the great opportunity to work with the Penny George Institute at the time, and it was amazing how much better people got with biofeedback and acupuncture and understanding their diet and inflammatory sources. So feel very blessed that way to really get to practice this, and had the wonderful Dr. Mimi Guarneri as one of my mentors, who is really the godmother of integrative cardiology. But cardiology is such a great place for integrative medicine because you can't go far without reading history, a poem, listening to music, and hearing all these things, such as having a heart of stone, having the heart of a lion, winning someone's heart. There's a lot out there. And that is because it turns out our mind and body, and in this case, our mind and heart, are very connected. To the point that even the CDC is talking about it. So it really is this chicken and egg, and it's fascinating because we don't actually know what causes what, because we certainly know for any of those who have family members who've had heart disease or have had heart disease themselves, but you go through any of these things and that next year at a minimum is really full of anxiety, a lot of depression, chronic stress. I see folks a lot the first 6 months after a heart attack because people are nervous. For many people, it's been their kind of first run in with what felt like it could have been death. What are all these little things I have in my chest now? Is that a sign? It's scary. And we don't do a great job studying this. But similarly, we know that folks, which I'm going to show you in the next couple slides, who are having more challenging mental health from social isolation to schizophrenia and everywhere in between, have much more heart disease, and they have a lot more inflammation. So it's a big piece of the puzzle. And I loved this Inner Heart trial that was done some years ago. Huge study, 52 countries. You can see the continents that were involved. And really the goal was to figure out, do we understand what causes coronary artery disease or the blockages? Is there something else that we're really missing? And the interesting thing that they really found in this study was that depression, stress, anxiety, anger, and social isolation accounted for 32% of cardiovascular risk, which again, we never talk about because there really isn't a pill for that per se, right? There isn't, just like we can talk about high blood pressure and we can slap a pill on it. We can talk about cholesterol, we can slap a pill on it. But this is something that is much more than that, because we're not just talking about depression that requires a medication. We're talking about some of these low-level things. And, for most of us in this room, I've never seen patient population or our country or the world for that matter as stressed as it is right now. And really, folks being as isolated as they are. So it's an issue, and as you'll see, it really gets to some of the disparities that we see with women as well. We've known other psychological disorders have had negative impacts on cardiac health. So schizophrenia, some of bipolar, we know there's been some higher correlations with heart disease for some time. Depression prevalence, like I talked about, is 3 times higher in patients after they have a cardiac event. And then we know that folks have impaired quality of life and some challenges with emotional distress as well. Love this slide. It's been a part of my deck for as long as I can remember. So I know that these things you can't really read, but I think that it's just fascinating that 70 to 90% of all visits to healthcare are related to some type of stress disorder. We once looked at the data at Alina, the system that Deb and I were at, and I'm a math major by background, so I love things making sense, though they never really do in medicine. But we looked at emergency room visits on a Friday night to see if we could, in sort of like inappropriate things that didn't have to be seen in the emergency room on a Friday night, to see if we could make some correlations with what was happening. And it was always some type of stressor that came up and ultimately had this person who'd had 4 weeks of whatever type of pain decide that day they had to be seen, that it was bad enough. So again, it's another area that we just don't talk about. And we have the physiology there to actually see in all of these various organ systems what happens with stress, but it's another area that we don't really talk about. So like I mentioned, here are some of the stats on what we know with women. 1 in 5 women every year has a mental health challenge. Depression's 2 times more common in women. Women are 2 times as likely to experience PTSD. Women are 2 times as likely to experience general anxiety. Women make less than men. And 65% of women are caregivers in some way, shape, or form. So this has always been such a frustrating thing for me. I have given lectures on heart disease in women since 2007, because again, about 12% of cardiologists are women. So if you're a female cardiologist, you're talking about women's heart disease. But we never talk about the role that women have in our society. And my sister, who doesn't have children by choice, we constantly talk about how things really changed when women entered the workforce, which I wouldn't change for the world. But that's really some of the disparities that we see in heart disease between women and men started right around then. And that's, you look at how unfortunately the food industry and different things responded based on what we wanted, faster meals, things that lasted forever. It's really interesting, but unfortunately, we are getting sicker because of a lot of this. So as I talked about, physiologically, again, love this because it's so old, because a lot of this data we don't actually need, 1628, but a mental disturbance provoking pain, excessive joy, hope, or anxiety extends to the heart, where it affects temper and rate. So sure, we've known this for a long time. And this is what we see now. Stress increases our sympathetic nervous system. We get to that fight or flight mode. Our blood pressure goes up. Our heart rate goes up. Our blood sugar goes up. Our insulin levels go up. And then we have more inflammation. Or we get semaglutide, I guess. No, I'm just kidding. So our bodies did these things, right, because we needed them to, if a tiger was chasing us. But now we live in that mode. Most of us live in that mode all the time, whether we're in traffic, whether we're in our inbox, on the medical record, you name it. And we're just living in these constant high inflammatory states that are really producing so much of our chronic disease. So you can see this is what happens from a heart perspective. All the stuff, heart rate, blood pressure, cholesterol, triglycerides, fat around the waist, metabolic syndrome, and this is a problem. We even have a specific cardiac condition called broken heart syndrome. And I don't know if you guys have heard of this before. The Japanese name for it is Takotsubo. It looks like octopus, which is what Takotsubo is in the heart. But it's a fascinating condition. I've actually looked through our database of this as well at our old institution. And again, shocking to no one, it's usually women, usually over 50. The interesting thing, it can happen in both good and bad times. So every once in a while, we will see somebody who actually had something really, really good happen and had a surge of catecholamines and stress hormones. And they come into the emergency room, their EKG looks like they're having a heart attack, their blood looks like they have a troponin leak, like they're having a heart attack. We rush them to the catheterization suite to see if they're having a heart attack, and their arteries look fine. And then we find that it is, in fact, we have a chance to take a more proper history, and you'll find out often someone died, someone got divorced, someone had bankruptcy. But it's really fascinating because this is a real phenomena that we see all the time. So I love this because it's a quote about the heart, and I think it's so real. Peace, it does not mean to be in a place where there's no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart. And I think that's real life. I always think when I'm up talking about this kind of stuff that people think that my life must be super easy and that I don't have any of those things, which is not the case. But I do think things have gotten so out of control that we have to be in this space where we can learn how to have these constant stressors impact us less. And I think that's part of what's so beautiful about integrative medicine, period, and just taking a more holistic look at how the mind, body, and spirit are ultimately connected. So lots of data that was done mostly with good old-fashioned transcendental meditation, the real deal stuff. But you can see here some of the studies that were done showing lots of improvement in cardiovascular risk factors. Insulin resistance, autonomic tone, reducing carotid plaque. I thought this was fascinating. There was actually a small trial showing a 30% reduction in cardiovascular mortality. If that was a drug, we would all have it and we would be, beyond billionaires. And then specifically a big risk reduction in our Black patients as well. These are just Calm and Headspace. We actually did trials with Headspace back in the day. But as little as 5 minutes of this can make a big difference. I was telling a few folks that my son, before he goes on social media, has put this on his phone, not one of these, but where he has to do a small meditation first before he goes on meditation. So there's things that we can do to teach this next generation and ourselves. This is a study that we did. One of our cardiovascular surgeons, Dr. Kashetri, did this back at Abbott, and the role of guided imagery. And once again, talk about something that makes sense. You're going into surgery, much less these were all open heart surgeries, that it makes a difference what your brain is thinking beforehand. So this was where folks had a little guided imagery that they were listening to as they went into the operating room, instead of staring at the white ceiling, thinking that you're gonna die, which unfortunately is what a lot of people think. And sure enough, they had significant outcomes in both pain, anxiety, and ultimately improved length of stay. Guess who thinks that is being done now in the hospital? Anybody? No, unfortunately it's not, because this was too hard for people to figure out a way to make sure that things weren't stolen, or, even to get it on somebody's iPhone. It's true. Do you remember that? We had like little MP3 players, and they were like, oh no, they're gonna steal it. So is it gonna be sterile? But I just think to myself, talk about things being the things that we could do that are simple. Biofeedback is amazing. I often have my folks do heart math, and because it's more accessible from a cost. And we used to have somebody that did biofeedback, but a lot of these folks have been challenging to get reimbursed. But for whatever it's worth, specifically, it really counteracts all the things that we're talking about. So it helps really teach people how to upregulate their parasympathetic nervous system and downregulate their sympathetic nervous system. And I'll tell you, with the Oura Ring and the iPhone, the number of consults that I get now from young 20-something-year-olds that are like worried about their heart rate recovery and all these different things, but not really doing things to help improve that, but just have a lot of anxiety about what they saw as they were sleeping, and then what ChatGPT told them that it could mean. So it's too bad that we don't have more of that. Tai Chi is another great one. There was a trial looking specifically at congestive heart failure. This one of my favorite things about this, for anybody who's really into cardiology, last year Medicare approved the TriClip valve for tricuspid regurgitation. So I'm not sure if you guys are familiar with this, but it's super controversial. And the only thing that this $30,000 valve did was improve a 6-minute walk test. And I constantly say to folks, we could have had these people do Tai Chi, literally, but this is now covered by Medicare. And coming to your hospital soon if it's not already here. So, but this is stuff that we should talk to our patients about, because it matters. So for all of us in the room, I think there's many days where we need to change how we react to the situation, finding the positive, slowing down, thinking before we react, learning to recognize what we can change, what we can't change. I think this type of negative, holding grudges, blaming, resentment, and setting limits. We were talking about, like, I don't do any charting anymore outside of office hours or traditional clinic hours, just because I think as healers, there's been more and more and more and more asked of us. It's huge. And we use a ton of aromatherapy back at the Alina days, but I think sometimes you just need something to change one of your senses. It's amazing how sometimes holding a cup of tea or the smell of lavender or some citrus or something and more asked of us, it's huge. And we used a ton of aromatherapy back at the Alina days, but I think sometimes you just need something to change one of your senses, and it's amazing how sometimes holding a cup of tea or the smell of lavender or some citrus or something can really change our mood. Of course, food is a big piece of this, and we were talking about Dean Ornish earlier, and Dean Ornish did this lifestyle medicine study back in the 90s, and really it's the only thing that's ever showed, I have another slide on it coming up, but that you can actually reverse obstructive heart disease. So not plaque that you see on your calcium score but actually obstructive heart disease. And really what it was, whole foods, plant-based, stress management, yoga and meditation, exercise. It was not high intensity interval training. It was just moderate walking things. And then this is a huge piece. Part of Dean's program, which was covered by Medicare, or is covered by Medicare, was social support and community. And you had to have one person in your life that you could be completely vulnerable with. And so it didn't have to be your partner, but it needed to be someone where you could just really show up as you. So I think that's huge. You know, about less than 5% of our entire country does these things. But this was his study that I still recommend his books to my patients all the time. So it was very powerful. And he subsequently went on to show that it also helped mitigate prostate cancer. So really, really helpful. And if I didn't tell patients whole foods, plant-based, then Mediterranean is the other one that has a little bit of evidence as well. But as we are living in this protein crazy world, it's really, folks are surprised to realize that we really shouldn't be having a lot of animal-based protein. And in general, probably the obsession with protein is much more than it needs to be. But these, for poultry and eggs, it's very moderate, like a couple times a week, not 3 times a day. So, yeah. And then sleep, I think, finally, is a really important piece of things that we really pride ourselves. I don't know if you notice when you're talking to colleagues and you say, "How are you?" "Busy." "I'm busy." Like, it's good. It's a sign that you're important, and especially those midnight emails. So 100 years ago, we averaged about 8 hours a night of sleep, and these days we average about 6. And again, a lot of us are on devices, all the things. And again, the healers in the room constantly, folks are getting people who are saying, "I can't sleep, I can't sleep, I can't sleep." But look at what it leads to: sleep deficit, weight gain, immune compromise, less restoration, and more inflammation. I think it was a really missed opportunity during COVID that we didn't talk more about the role that sleep could have had from an inflammatory and an infective perspective, because everybody was getting every supplement they could to try to mitigate COVID, but we didn't talk about the role that sleep actually had in helping our immune system work well. And of course, a little plug for sleep apnea. So social connection, just like we're here, this is something that I talk to my patients a lot. I don't have any prescription pads anymore, but when I did, I would actually write a script saying that you have to connect, because we know people live longer who are connected to others, but a lot of us, and especially women, especially caregivers, tend to really get inundated with just their families or just their caretaking, and aren't seeing friends, and it's really important. So that's something worth putting on your calendar and making sure that we're thriving, not just surviving. So this is me and my Sophia, and I always say, again, like as I mentioned, that life is very real for me. This is my daughter who passed away. It'll be 10 years ago on Saturday. She was almost 8, and I say that because I do feel like I'm thriving here, and integrative medicine was a big part of seeing the light each day. And all those little things really made a big, big difference in terms of how I was moving my body, what I was eating, how I was sleeping, all those things. And I put this on there just because, you know, all of these are things that I definitely feel like, this is me in my office on my noon runs, which I go for every day I'm in the clinic, because that's when I can get it in. And I've been doing that since I started practicing in 2010, and I remember doctors making fun of me and being like, "She must not be working hard enough." But it turns out I show up very differently in the afternoon when I've gotten outside, saw that there's something bigger than just what's happening in the clinic. A lot of these things are heavy as we're counseling people about life and death, and it's important to do these things for ourselves. So I would just say, invest in you. You're worth it. This is one of my favorite places to heal, in Nosara, Costa Rica. Yeah.
That was a wonderful presentation. Thank you. And there was a lot to learn, a lot to absorb. If you want to stand up for a couple minutes, shake your legs, shake your arms, let this kind of sink, because our next topic is going to be another wonderful presentation. So I want to make sure that we stay in focus. So let's take a break for just maybe 2 minutes and come back. So Dr. Baechler, that was a wonderful presentation. And there was a lot to learn here. It was very interesting that from the perspective of traditional Chinese medicine or East Asian medicine, there's a very special place for heart. Those who are familiar with 5-element and acupuncture, heart is the emperor, rules the kingdom of the body. And when the heart is not calm, nothing is calm in the body. So all the organs and everything in the body work in a way to make sure that they keep the heat out of the heart. They keep the stress out of the heart. They keep the emperor calm, so the realm could be in peace. So that was very interesting to see how old medicine translates into modern medicine, and they come together here. So the next topic is very interesting, and it ties very well to this first part. Originally, we had this presentation the other way around. We had Emily first, and then we had Dr. Courtney second. But I'm glad that we switched it because it makes more sense this way. So for me to introduce Emily, or as we know it on social media, Dr. M, I don't know where to start. I have known M for many, many years, since I hadn't even started at UW. And Emily has been a wonderful friend, coach, and mentor. She has a special place in my heart, and we keep checking on each other every now and then, making sure that things are going well. So thank you for being such a dear friend, but I think I have to formally introduce you here. So Dr. Emily Wong authors I Heal magazine, a blog focused on brain health and aging. She's an integrative internal medicine physician, educator, and certified health coach with MD and Master of Health Administration degree from University of Washington. Dr. Wong completed fellowship training at the Andrew Weil Center for Integrative Medicine and has held leadership roles at UW Medicine, including Medical Director of Women's Health Care Center and Chief of Medical Staff at UW Medical Center. She continues to teach at UW and Hong Kong University and speaks on brain health, menopause, and lifestyle medicine. And we are very pleased and happy to have you here tonight with us. Thank you.
Hello. Thank you so much for being here tonight. I really appreciate the opportunity to speak with you. Just going to pull my slides up here. And I wanted to say that, this was an amazing setup. Thank you so much, Dr. Baechler. I want to say that, just to follow up on what Iman said, in Chinese medicine, we talk about how the heart is the emperor, as Iman was saying. But in Chinese medicine, as it turns out, the mind lives in the heart, right? And so I think there's a lot of wisdom there. And I want to just share a funny story. So David Richardson, who does research, of course, on dementia and Alzheimer's disease and so forth, a neurologist, was studying the effects of meditation on the brain. And so, sorry, this is unscripted, not part of my talk, so forgive me for this 2-minute story. But he was doing studies on, I'm good friends with Barry Curzon, who's a personal physician for the Dalai Lama. So Lama Barry was telling me about how they were doing these studies where they were, putting all these electrodes for EEGs, to figure out what were the effects of meditation, right, on these long time, master meditators from Tibet and from the Dalai Lama's, monastery. And when they were doing that, and they were telling the monks that they were going to study their minds, they just laughed because they were like, Why would you be putting the electrodes up there? Everyone knows that the mind is here in your heart, right? Funny story. And it turns out that in Western medicine, we're learning more and more that what's good for the heart is what's good for the brain. And it turns out that vascular medicine, is all about inflammation. And whether we're talking about your vasculature going to your heart or whether it's going to the brain, it all contributes. And it turns out that when we think about dementia, when we think about Alzheimer's disease, really the vascular component is right in there, right? So there's almost every type of dementia is a mixed dementia, and the vascular piece is going to be a huge piece. So let's talk a little bit about brain health coaching. Let's see. Sorry. Here we go. And there's two parts to this talk. So the first one is I'm going to explain to you what I understand is brain health. I'm going to talk to you about how to protect your brain health. And once you figure out how important it is, I hope that you will join me in this journey on, basically learning how we're going to take better care of our brains from now until we live to be 100. So that's the goal, right? And we're going to talk not just about what to do, which is what Dr. Baechler is very lovely, was very kind in introducing, how we take care of ourselves, how we take care of our hearts, how we take care of our brains, but also, how to actually motivate ourselves to do what it is that we need to do. Because it's not as if we don't know what to do for the most part. We do know what to do, right? We just have problems doing it all consistently all the time, right? And so that's where the brain health coaching comes in. And when we talk about brain health coaching, I'm going to talk to you a little bit about self-coaching. Because I think when we talk about coaches, we think about, oh, there's a professional person who's going to have to help me with this. No, actually, these are skills. These are tools you can learn for yourself. And I want you to learn them for yourself because it's extremely empowering. Okay, so let's start by talking about what brain health is. So what is brain health? This is a definition from the World Health Organization. And what we're going to talk about here is how there's two components to brain health. Let's see if I can get this pointer to work. There's a now component, and then there's a future component, okay? So the now component really refers to our executive function, language, attention, processing speed, memory, and so forth, right? And we call this bucket the cognitive health, right? And the future component is really, right, allowing a person to realize their full potential over the life course, right? So in the future, right, when we're 80, 90, 100, we all want to be sharp, active, and juicy, right? So how do we get there? How do we get from here to there, right? And it turns out that the answer is that our cognitive health really sits on top of our emotional or mental health, as we heard from Dr. Baechler, and all of that sits on top of our physical health, right? So all of these components, sleep, eat, move, right, liver, heart, gut, all of that contributes to our overall health and our brain health, right? So this is an interesting phenomenon. I call this the everything bagel of brain health. Because if you think about it, right, everything to do with our brain, think, focus, remember, be creative, solve problems, right, tell stories, build memories, relate to our loved ones, our brains are who we are. Our brains are our identity. That's how important our brain is. We all get that. But what we don't get is that everything about our health that we've been talking about, stress, blood pressure, heart health, sleep, nutrition, all of this contributes to your brain health. I call this the everything bagel of brain health because there's a hole in the middle. We don't talk about it. We don't connect those dots between all these other aspects of our health and how they sum up to our brain health, right? So that's how important our brains are. When we take care of ourselves, when we get enough sleep, when we move our bodies, when we eat right, we're taking care of our brains. We're taking care of our whole identity. Right? So not an organ-based thing. This is who we are, right? That's what our brains represent. Okay, so hopefully I've convinced you that your brain health is important. You kind of already knew that, right? Let's talk about neuroscience for just a moment here. So when I talk about brain health, right, to a neuroscientist, what does that actually mean? That's actually what they call brain resilience, okay? So brain resilience is how we adapt or recover in response to stress, adversity, or age-related changes, okay? And there's these neurobiological mechanisms, neuroplasticity, connectivity, and so forth that actually, right, lead us from whatever it is that we're experiencing now to either causing AD, Alzheimer's disease, neuropathological changes, right? So these are neurofibrillary tangles, this is amyloid plaque, right? Or it causes neuropathological change, which is resilience, right? So some of these factors lead to more neurodegeneration, and some of these things cause resilience, right? And it turns out that some of these risk factors, lifestyle and behavior, social and emotional factors, are some of the things that are going to help us. That's what we have control over, right? We don't necessarily have a lot of control over our neurocircuitry, right? Or what's going on here biologically. Maybe you have some genes, maybe whatever, right? But here are the things you actually have some control over, and that's what we're going to talk about when it comes to coaching, because that's something you can do for yourself. You can shift the trajectory so you're going in the direction of resilience. You're helping your brain to be more resilient, right? So when someone has a stroke, when someone has a brain injury, it turns out that, the brain actually has an amazing ability to recover, right? You've seen that. You've seen these remarkable stories of how the brain is adapted. But not all brains are the same. Not all brains will adapt in that way, right? And what makes one brain more able to adapt than another? It's resilience, right? It's their ability, right? Their brain's ability to repair and come back from whatever that injury is. Okay, so as you've heard from Dr. Baechler, there's no single silver bullet. I get this question all the time, right? What's the one thing I can do? What's the one thing I can do that's gonna make my brain free of dementia, right? Okay, I wish there was a silver bullet. Usually they're talking about a pill. They want a supplement, they want a pill. I just want to take a pill, right? Well, sorry, it's not that easy. You actually have to put some work into it, right? You actually have to take care of yourself every day. Every time you put food in your mouth, every time you go to sleep at night, every time you move your body, that is a vote for a better brain, for better brain resilience, right? That's what we're talking about here. And that's going to take some coaching for most of us. I mean, some of us are very disciplined and we can just, read an article and, okay, I'm going to go do that. And they just do it, right? Good for you, if that's one of you, right? That's not me. That's not me. I'm kind of like, oh, I got to work on it. Oh, no, that didn't work. Okay, let me try that again, right? And I got to work on it and keep working on it. And you know what? I'm going to keep working on it. I'm going to keep working on it for the next 40 years. I'm 59 years old, and I'm going to keep working on that until I'm 100. That's my goal. My grandmother lived to be 106. So I have a pretty good chance of living to 100. And I want you guys to all come with me. I want you guys all to be at my 100th birthday party, right? That's the plan, okay? All right, so there's all these components that are going to help us with our brain health, right? We're going to talk about some of these things. We're going to talk about rewiring our brain for better habits. We've already talked about connection. We've talked about taming stress, right? We're going to talk about having good fuel, good nutrition, and sleep, and all of these things, right? It's an entourage effect, okay? You get to be the architect of your own brain healthy lifestyle, right? And let's be honest, that's a little scary, right? That's a little scary because that means that we have to be responsible for our own brain health. That there's not going to be a pill. There's not going to be something that somebody's just going to come along and say, here, this is the magic ticket. No, it doesn't work that way. You have to do the work yourself, okay? What we do know, the good news is 40% of dementia cases are preventable through lifestyle. 40% people, that's a big number, right? You could be one of these people who gets your act together in terms of taking care of yourself. Chances are you already are. Otherwise, you wouldn't be here. You wouldn't be at this talk, right? You wouldn't be interested in integrative medicine, right? You are already one of these people. So good for you. Give yourself a little pat on the back, right? Okay, so let's talk about some research here. This is a study that talks about how the more habits you have, the better off you are, okay? So this is called the Chicago Health and Aging Project. It's a study that's been following a cohort of people from 1993. And what they did is they basically looked at the proportion of people who, the proportion of people's lives that they will live with or without Alzheimer's disease, okay? So if we look at this blue line here, okay, this is the 0 or 1 healthy factor. Sorry, this is women, this is men, okay? And so what are healthy factors? These are the healthy factors. There's 5 of them. So you either have this MIND diet, right? So that's the Mediterranean diet, right? Plus the DASH diet. And that's a diet that has been studied for, its association with better health outcomes when it comes to brain health. Moderate vigorous exercise, cognitive activity score. So what are you doing in terms of stimulating yourself cognitively, right? Are you reading the newspaper? Are you, doing the crossword puzzle, things of this nature, right? Are you a smoker or non-smoker, right? Or do you have light or moderate alcohol? So these are the 5 factors, right? And so if you take the baseline, which is this blue line here, right? Let's say you're a woman here, you're 65 years old, you have about a 20% chance of going on to live the rest of your life. 20% of your life could be, 80% of your life is going to be without Alzheimer's disease. There's a 20% chance you're going to have Alzheimer's disease, right, as you get older with this particular cohort, right? When you're 90 years old, you have an 80% chance of having Alzheimer's disease or living with Alzheimer's disease, right? And only 20% without, okay? So now look at somebody who has 2 or 3 of these healthy factors. 2 or 3, this line moves down to this yellow line, right? So it goes from blue to yellow. And if you have 4 to 5, you've just moved down to this pink line here, which is pretty remarkable. You've gone from having 80% chance to a 40% chance of your life, right, the rest of your life, of having Alzheimer's disease. That's pretty significant. That's pretty significant. For men, it's even more significant. So this is the men's chart. So we're talking about women's health here, right? This is a women's health series, right? Why is it that women have so much higher of a chance of living the rest of their lives with Alzheimer's compared to men? Look at men. Look, there's some men who will never get Alzheimer's disease. What's with that? Why is that? Why does that happen? We don't know, right? There's ongoing research that looks at why there's so much higher risk for women in Alzheimer's disease, right? We don't know the answer. It might be hormones. It might have to do with, some kind of period during our lives when we have worse sleep. One of the main culprits is supposedly around menopause. Women get less, good sleep during that time. Maybe, we don't know. We don't know the answer. But a lot more research needs to go into this. And it's something that we as women need to understand, that we are all at higher risk for getting Alzheimer's disease. Okay? All right, so that's what we call correlation data. Correlation data is where, we don't make people do these things. We don't make them exercise. We don't make them eat certain way. We don't make them sleep, right? We just say, oh, you're doing that. And look, when you're doing that, you have better or worse outcomes, right? So that's what we call correlation, which is not the same as causation, right? So now we're going to look at causation. So now we get a group of people together and we randomize them to two different groups. Sorry about that. One group, has a very structured approach to these interventions. So this is called the U.S. Pointer Study, right? It just came out actually 3 months ago in JAMA. And this is what they call their brain health recipe. So they do cognitive exercises, computer-based brain training programs. They have, physical exercise, they're monitored, right? And then they have this, nutrition adherence to this MIND diet that we've talked about, right? And participants followed either a self-guided or a structured lifestyle program, right? And they followed these people, it's a randomized trial, 2,000 people, right? Mean age around 68. There were 5 sites, multi-center trial across the U.S., huge endeavor, right? The baseline population all had increased risk for Alzheimer's disease. They all had increased risk. What does that mean? That means that they had both a sedentary lifestyle and a suboptimal diet. Anyone you know? And they had 2 additional risk factors. Either they had a family history or they had a cardiometabolic risk factor. Cardiometabolic risk factors are what Dr. Baechler just talked about: hypertension, diabetes, cholesterol, right? This is the kind of thing that puts you at risk for Alzheimer's disease. Okay, so then they measured their global cognitive function over 2 years. So they assessed, all of these parameters: executive function, episodic memory, processing speed, and so forth. What happened? So if you look at these studies, when you look at these outcomes, it's very interesting because what they show is that these orange dots is the structured group, okay? And what you're seeing over a 2-year period of time is that their scores got better and better. over 2 years with these interventions, right? So very impressive. I'll tell you what's even more impressive. Look at the self-guided control group. They had almost equally good outcomes. As far as I'm concerned, they did darn good by themselves, okay? Look at this. This is the group that was the control group. They only had 5 team meetings over a 2-year period of time, and they achieved this. Hello, that's pretty impressive, right? As opposed to the structured group that had 71 contacts. That's a lot. That's a lot of contact, right? But only to get that much better. What does that tell me? That tells me that if we're doing it ourselves, this DIY plan, this could work. This could work, right? You don't need 71 contacts over 2 years. You can do this yourself, okay? That's where the brain health coaching comes in. That's where the self-coaching comes in. Okay, so as we've talked about, knowing what to do is not the same as actually doing it. Not the same as actually consistently doing it every day, right? Knowing is not enough. We must apply. Willing is not enough. We must do, okay? So the thing is, there's no one size fits all, right? We get to each customize our own approach, right? And how do we do that? So what's a little bit of extra help, right? What's those 5 team meetings over the course of 2 years? What did they actually do during those team meetings, right? What happened? Well, it turns out those people are probably pretty motivated to begin with. Otherwise, they wouldn't have been in that trial. They wouldn't have enrolled themselves in a clinical trial to begin with. But you're motivated. You're here at this talk, right? So you could be like that. Okay, so let's talk a little bit about what I am calling brain health coaching, okay, and what self-coaching is and how do we do it, okay? So let's talk first about coaching, because you may not know what coaching is. Like, we've heard of coaching, we kind of think, oh, is that like therapy? You know, nobody wants that. Okay, so what is coaching? So coaching, if you think about it in a sports analogy, so let's say I'm trying to play a better game of tennis, right? So if I want to boost my performance, I build my strength, you know, do my kind of like gym. I increase my stamina. That's what my coach is going to get me to do. Like, oh, you're winded after the first set. You got to like go and run or something, you know, build up your stamina, right? Improve your flexibility. Your backhand sucks. You know, you got to like twist your body more. You don't have enough flexibility, whatever, right? Okay, so those are the physical components of what a coach will help you with, right? But what about the mental part? So coaching is also about building awareness, like awareness that your backhand sucks, right? Or that you need to shift your grip. You can try different things, right? Identifying obstacles. Maybe your grip is the problem. Maybe your weakness in your arm is the problem, right? And then growth through incremental challenge. So we're going to try something different. We're going to try this. We're going to try that. We're going to drill and drill and drill, right? That's what a coach does. Everyone understands that. Okay, now let's talk about self-coaching. So what is self-coaching in the context of building a brain-healthy lifestyle? Okay, so that's what these tools are about, right? So there's rewiring habits, which means whatever habits you have right now, right? How do you tweak those? How do you, turn them into better habits, right? Maybe you already have a lot of really good habits, right? We're going to talk a little bit about that. We'll touch on that. And what's feelings fluency? What does that actually mean, right? That's how we build stamina. We build stamina through understanding how our body is responding, right? So when we start having these new habits, what are we feeling inside our body? What's the dialogue? What's the conversation that we're having with our body? And how do we learn to trust those signals, right? And then mindset dexterity, which is flexibility. How do we think differently? How do we, what are these obstacles that are standing in our way, right? So coming back to building awareness, identifying obstacles, and growth through incremental challenge. By the way, as you acquire these tools, there's the added bonus that you're actually building your neuroplasticity. You are actually building more resilience into your brain because you're building new neural circuitry, right? You're building new neural pathways as you do this. Okay, so let's talk about rewiring habits. What do I mean by rewiring habits? So if we talk about a brain-healthy lifestyle, right, it's like a house. And each of these habits is like a brick, right? So all of these bricks, right, form a house. And you have a lot of years to build this house if you want, right? So you probably have a lot of existing habits that feel very automatic to you, right? Driving a car is a habit. You don't have to think about it. You get in the car and you just go, right? Hitting the snooze button, right? Hit the snooze button. I don't have to think about it, right? Yeah, we all do it, right? So not hitting the snooze button, if I were to decide to stop hitting the snooze button, right, that requires us to build new neural pathways, which requires us to have awareness, right? Understand what the obstacles are and deal with those challenges, right? So that's what we're doing when we're rewiring habits, okay? So now let's talk about feelings fluency. Okay, so what gets in the way of our best intentions? Well, we do. We get in our own way, right? So let's just say I'm going to have this new habit. I've decided that I'm going to wake up earlier every morning. I'm not going to hit the snooze button. I'm going to get up earlier and I'm going to go for a run every morning. Okay? Did you just feel the energy in the room drop? Yeah, everybody felt that, right? We all felt that. What was that? That was a habit. That was a thought habit. We all have this thought habit that it's impossible to not hit snooze, right? We all have this thought habit that it's impossible for her to get up in the morning and go for a run and not hit the snooze button. I don't know how she's going to do that, right? So we've kind of like pre-disappointed ourselves already. That is what coaching is about, my friends, okay? It's about identifying, having the awareness that you have that thought habit and addressing that, okay? So it's impossible, it's so difficult to change this habit. That's one of our obstacles. A second obstacle, maybe I have this irritation, frustration. Oh, I don't want to get up, right? Yeah? So there may be some emotion there. So that's another one of our obstacles, yeah? A third obstacle are physical sensations. So beyond emotions, there's this pleasure. I'm in my bed, I'm warm. Oh, I don't want to get up, right? I'm tired. I'm so tired. I don't want to get up, right? These are physical sensations. So feelings fluency, all that means is just becoming fluent in the language of your body, becoming fluent in this dialogue when your body gives you these signals, understanding them, being aware of them, right? Another word for this is mindfulness, right? Right? It's like being mindful of what's going on in your body and figuring out how you want to respond to those signals, because we're very used to just like overriding them, like, I'm just going to, right? I'm going to muscle through this. I don't care, right? And you can discipline your way through this. But if you're going to keep doing this for the next 30, 40, 50 years, right? Think about it, right? What's going to work for you? What's going to be sustainable for you over the long term, right? If it's something that you hate, you're probably not going to want to do it for 40 years or 30 years or even 10 years, right? Okay. So feelings fluency is about slowing down, tuning in to those interoceptive sensations, right? Interoceptive signals. Interoceptive means we're paying attention to our body signals. It might be an emotional signal. It might be some kind of physical signal. My heart is beating fast, right? Some kind of signal is going on in my body. What am I feeling physically and emotionally? What am I thinking? And what do I need? What do I need right now, right? So it's this mindful reflection and choice. I call this mental noise, right? We take a breath, we settle down, and we drop, okay? So that is kind of one of the first steps when it comes to becoming more fluent with our feelings, okay? Now we're going to talk about mindset dexterity, and we're going to talk about it in the context of aging beliefs, because believe it or not, when we have these kind of beliefs, right, what we call a fixed mindset, right, that means that, nothing's ever going to change. It is what it is. I'm getting older or whatever, right? Like, nothing I can do about it, right? It's all downhill from here. You can't teach an old dog new tricks. It's embarrassing to wear hearing aids. Anyone hear their parents say that? Embarrassing to wear hearing aids. It's embarrassing to use a cane. How to use a cane, right? Too old to learn that. Yeah? Okay. As opposed to a growth mindset, right? Growth mindset is like, oh, well, anything's possible. I could try, right? Like openness, right? Openness to trying new things. That's what a growth mindset is. I get to decide how I want to age. I don't have to believe that it's all downhill from here. It's empowering to learn new things instead of, oh, I'm not going to learn that. That's too fun, right? Maybe new technology is so helpful. You know, those hearing aids are pretty cool. Pretty cool. You can get them at Costco now. Really cheap. Okay.
That is clear.
So Mary Pfeiffer, who wrote Women Rowing North, says that ageism is a prejudice against one's future self. We all practice it. We all practice ageism. I have it, right? Sometimes I'm not conscious of it. Sometimes I try to be a little more aware of it, right? But it turns out that ageism actually affects health outcomes. So you're probably aware that there's a growing body of literature about how ageism actually, especially negative self-perception, can affect our health. Turns out that it not only is associated with higher rates of dementia, so cognitive decline, measurable cognitive decline in people who are have more ageist beliefs, okay, about themselves, right? Not only do they have poor clinical outcomes, it turns out they have more pathological changes in their brains. What? When I'm aged against myself, I'm more likely to have amyloid plaque and neurofibrillary tangles in my brain. How does that even work, right? When I feel prejudice, when I'm frustrated or embarrassed, right, then I'm going to do more poorly. So they've done these studies where they've taken somebody who's elderly and some kind of comment, right? The researcher went in the room and just basically made some kind of microaggressive comment like, oh, another old person, whatever, right? And it turns out that that frustration, embarrassment, shame caused enough anxiety to impact their performance on memory and balance testing compared to someone who had not encountered that microaggression, right? How we act when you don't believe that your life is worthwhile or you're, you know, I hate getting old. I'm not going to take these medications, whatever. I don't care, right? Anyone's parents do that? Yeah. I don't need to eat healthy. I've always eaten this way. I don't need to change, right? Exercise, whatever, right? So mindset has a huge impact on our health outcomes, and our risk for dementia. So the thing about stereotypes is that there's unfortunately almost always a grain of truth about them. And I call this default aging, you know, kind of the default aging pathway, right? We're stressed, we're underslept, overworked, sedentary, right? This is the superhighway to chronic disease. It's the superhighway to metabolic disease, high cholesterol, hypertension, what they call biological frailty, right? Biological frailty means we have a lot of chronic conditions. We have a lot of chronic conditions. And so, you know, you can choose this path, right? You can choose this default aging pathway. There's probably a lot of people you know who have chosen it, right? Or you can choose what I call the road less traveled, right? And that means being very intentional about taking care of yourself, taking care of your body, taking care of your heart, taking care of your soul, your relationships, right? And your brain. So just to give you a little disclosure here, this is my grandmother. She lived to be 106. She died in August. And she did have dementia. She lived with dementia for 18 years. So that's my motivation for doing this work. My motivation for doing this work is to help you understand that you have agency over this. You can choose your own lifestyle, right? And you can actually make a difference yourself with just a little bit of help. Thank you very much. That's best.
Thank you so much, and a wonderful presentation. I'd like to thank the Osher staff, especially Carol and Kim. at the back here. She single-handedly put all this together, and of course other people joined and helped, but it was her and her making this able to get together. So thank you so much for every work that you did, and hopefully next year we'll have more staff that can help us with these events as such. So with that being said, are there any burning questions? I think the presentations are very self-explanatory and a lot to absorb and a lot to think, a lot to reflect, and they pretty well blended into each other. So take care of your heart, take care of your brain. The prescription is connect, eat well, sleep, live healthy, and be happy. So with that,
I have a question for Dr. Wong.
Yes.
I love when you talk about taking care of ourselves. And I'm thinking about the future of healthcare as our population age, and shifting from treating disease to preventing disease and foster health is important. And I'm curious to hear your thoughts in terms of how technology can be used to ensure or help us to live better rather than to help us to treat disease, as sort of helping the road less traveled as we think ahead for the next 50 years.
Thank you. What a great question. I think that there's a lot happening in this space, in the technology space, honestly, that's actually very, very exciting. So, I mean, it's everything from, these apps that Dr. Baechler had mentioned, like the meditation apps, right? There's also a lot of these self-monitoring apps, the Aura Ring, the Apple Watch, right? These kinds of devices, the wearable devices, I think is another opportunity for us. I think that in my experience, it really depends a lot on the patient, because there are some patients that become very anxious, right? They become very anxious with all this data, and that can be counterproductive, right? And some people really love the data and they find it very motivating. So what I typically counsel people when it comes to technology is to really kind of lean into what they know about themselves. Are you the kind of person who's going to become more anxious when you have this, when you see that you're not sleeping enough, when that Aura Ring is showing you that? Or are you the kind of person who's going to be motivated to make changes because you see that, so I'm actually going to go to bed earlier, I'm going to take my phone and charge it in another room? Are you that kind of person, right? And that's a lot of what I'm trying to teach people with the self-coaching, is to really learn to trust themselves and learn to trust what they know about themselves. Because I think that as doctors, a lot of what we do is we try and take that kind of control, away from them, or they hand it over to us, whether we want it or not. And they're like, you're the doctor, tell me what to do. That's actually not how this works, right? How it works is they have to do it all the time. We as doctors, we see them for like 20 minutes, twice a year maybe. The whole rest of the time they're with themselves. And that's why the work of this Osher Center and this integrative medicine stuff is so important, because this is how we support people every day, right? Not just when they're here in the clinic with us. Thank you.
Thank you so much. So the QR code regarding survey, please give us feedback. We would appreciate your feedback. Based on that, we plan next year. And with that, we're going to wrap up. Thank you so much for being with us tonight. Eat well, sleep well, and stay healthy. See you guys later. Thank you.